You're flying in for surgery and you're worried about the process. This is what you can expect. So about 60% of my patients fly in from outside of Los Angeles. Sounds crazy, but believe it or not, this is pretty typical for some of the higher end plastic surgery practices that are here. So what do these patients experience? What will your experience be like? Okay, you're gonna come the day before surgery so that we can check in, do photographs, make sure that your plan is correct. Because if I've only seen you via virtual consult, I need to see you in person to make sure that things look the way that they actually do. I may change the plan the day before surgery. It's rare, but it's not gonna be a huge change. It may be a small change depending on what we see. The day of surgery, we're gonna do the markings. I'm gonna check in with you in the morning. I'm gonna be with you while you're going to sleep. And then afterwards, you're probably gonna be going to an aftercare facility. There's nurses there that can be with you 24/7. I'm gonna see you that night and the next morning. In the week that follows, there are different options. There's one hotel that's right across the street from my clinic. It's literally a one-lane road. It's called the Mosaic. There's a whole wing of patients over there that are it's called the Gould wing because people are all there from out of town. Those rooms are relatively affordable and they're easy to access. It allows you to come over, get red light therapy, and see the clinic in the days after surgery. You may wanna do an Airbnb, or you may wanna choose a different type of place if you have an account that works better for you for a hotel or a friend that lives nearby. By day 7, you're feeling much more comfortable. In most of the surgeries that I do, patients are able to fly home between day 7 and 10. We've gotten through the early window of potential complications. We know that you're on track. You're pretty much close to done with pain medications and other medications that are necessary right after surgery. We've gotten past the length of time where bleeding after surgery is a real potential. So you're in the safe zone. Now, after day 7 to 10, you go home, you feel more comfortable. We're keeping in contact with daily text messages from my nursing staff and my patient coordinators, and you're checking in with me at set time points, usually something like 4 to 6 weeks post-op back at home. You see me at 1 day, 1 week, maybe 2 weeks, and then close to 4 to 6 at home. 3 months out is when we're probably bringing you back, 3 to 6 months. Why? Because we need to do something else. I'm not gonna make you fly all the way back to me unless we're actually doing something to make you look better. What would that be? Maybe a CO2 laser to improve the quality of skin on your face, or to improve the incisions that are there. An injectable anti-scarring medication. We're not gonna force you to come all the way back from Hawaii or Kentucky just to take photographs, say you look great, and kick you out the door. Now, 6 months you're doing better, another virtual. 1 year is when we have our final conversation where we say, do things look good? Are there other things that I need to do? Or is there a potential revision that needs to be done for a scar or something that bothers you? After that, a 2-year follow-up sometimes happens via virtual, sometimes in person. I love seeing my patients in clinic, so the more often you can come to see me, the better. But we're not gonna force you to fly all the way back out just to say you look great, like I said, and take photos. That's the out-of-town experience. The truth is there are many other factors that go into what happens when you come from out of town. Between my nursing staff, my patient coordinator, they'll be discussing the nutrition supplements, the hyperbaric chamber treatment, the aftercare facility, all the steps that we take to ensure great outcomes for those who come from far and wide.